Prince George has a very active and large seniors population, and Northern Health has been working hard to plan and deliver services that meet the full range of health needs for this growing demographic. Northern Health is engaging in a number of activities, services, and program development aimed at promoting seniors' health around Prince George. First up, the Elderly Services Program, where promoting social inclusion, active living, and emotional well-being of seniors is a high priority. Christiane Hirt is a social worker and program manager at Legion Wing, who actively engages elders from around our community as part of her outreach work.
Practice a HEAL program, which is healthy eating, active living. So one of the things that our seniors do is garden at the Queensway Garden. They're also involved in various other groups. We have a walkabout group. Our seniors walk and put all their mileage together. We are getting close to Vancouver. So some of them might only be able to walk maybe a kilometer at a time, while others might work 10 or 12. Part of the community garden and the healthy eating and active living is actually working in the garden, growing your own food. As well, we have a community cooking group. We do various other programs. We do Tai Chi, helps the seniors with balance, so they can remain independent longer. Most of the seniors are fiercely independent, so if you just give them the tools, they're able to show us what they're actually capable of doing. Living how they may have lived when they were growing up. So this is a housing project where 20 seniors live together, work together, as well as play together. Often they don't have families, so they participate in working with each other and also sharing life's challenges with each other. It benefits because not just their physical health, but as well as their mental health. Seniors who often have diagnosis of depression or anxiety are actually able to look forward to something. Their life all of a sudden has a meaning and a benefit to self and others. So it's really hard to capture how gardening can be a prescription, but a lot of physicians are now seeing that as not just preventative health care, but also maintenance health care. It's a pleasure to work with seniors, and they show us that remaining active is important into later life.
While health promotion programming is an important priority, seniors in Prince George have repeatedly pointed to an increase in affordable and appropriate housing options as a need in our community that directly impacts the health and quality of life for older adults. One project that is helping to address this need is this facility, the Gateway Lodge at 20th and Victoria in Prince George. In addition to the very important issue of housing, seniors in Prince George have been providing information and input about their needs in a variety of other areas through a series of dialogues, surveys, and forums over the past couple of years. Northern Health has been an active partner with the City of Prince George, the Prince George Council of Seniors, the Immigrant and Multicultural Services Society, and the Network for Aging Research to engage older adults in communicating their needs and working together to address them.
Prince George began responding to the priority that Council and the Mayor had afforded to seniors' quality of life in our community. And for that reason, we engaged seniors in a survey process to say, from your perspective, what are the issues that you think need to be addressed in this community? And not surprisingly, the three issues that they identified were housing, health, and financial security. Northern Health came to the table in a big way. They provided senior administrators during a morning session to talk all about the great things that Northern Health was already doing to address seniors' issues. And I think that's a really important point, because part of what needs to happen in a community is good sharing of information about the resources that are already available.
Northern Health has a new program called Healthy Community Development, and the idea behind this initiative is that we don't work so much with individuals who are in need of healthcare. We actually work in the community, helping organisations like the Prince George Council of Seniors. So it looks at the broader determinants of health, what we can do as a community to stay healthy and actually not end up in the doctor's office. And members of the Prince George Council of Seniors were very active and very inspiring.
We meet to actually discuss seniors' issues and be a voice for the seniors in our community. We can keep seniors in their homes longer, and so we are involved with Northern Health in an advocacy role for seniors as well as having contracts with them.
Northern Health funds some programs for us. They fund the Meals on Wheels program, which is for people who can't get out. We deliver meals Monday to Friday in the Bowl area. They also provided us with the help of Theresa Healy, who came and did some team building exercises, and for our long-term health, we've worked on a 5-year plan, and they also fund our info line here, which is a number that people can phone in, seniors especially, and get help with various problems.
As you know, we're looking at shifting demographics. We're going to have a significant percentage of the population are going to be seniors. And the Prince George Council of Seniors is really well placed to actually make sure that the seniors in this community receive the services that they actually need in the place and the time that they actually need them.
As you can see, seniors are active, engaged, and important members of our community. Northern Health values the wisdom of these community leaders, and our work with seniors continues. We're excited about the progress being made in responding to the needs of this growing population. For Northern Health Highlights, I'm Erin Collins.